Hello and welcome. I'm Dr. John Stracks. I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about working with me or working with our team, please visit our website at cormendyhealth.com. I'm here today with Dr. Laura Birk, who's a certified health and wellness coach who has also published extensively on the social aspects of chronic pain and illness. Laura had a catastrophic orthopedic injury when she was 16 and then lived with debilitating and progressive chronic pain for almost 30 years before she found mind body medicine healing. She now knows firsthand the profound healing power of the mind, even when one's pain is a profound and complex combination of structural and neuroplastic. You may have heard Laura's story from an interview that she and I did in December of 2021. And I'm very happy to have her back today to tell us even more about her healing journey. We'll start by having her give an update as to what's happened with her health over the past 2 years. And then there are three aspects of the story that I want to delve into a little bit more deeply. The first is how we tap into the healing power of the mind, even when there are structural issues present as well. The second is the complicated issue around healing from trauma and what to keep in mind if you are working through trauma. And then the third is how we create a healing community around us to support us as we go through the healing process. So, Laura, thanks so much for being here. And I'm so glad that you're back.
Thank you so much, Dr. Stracks. It's a real honor to be here and to be able to speak with your listeners again. So thank you for having me.
Great. So a lot of people who are watching have heard your first interview, but not all. So let's start with a quick review of what we talked about there. You were what, 16 years old when the injury first happened?
Yes. Yeah, I was 16 years old. I was a soccer player, very avid runner, all of those types of things. And just to give you a brief overview, it was a long history. It started with this sort of catastrophic, well, not sort of catastrophic medical emergency, something called acute exertional compartment syndrome. And it happened on the soccer field, and I got carried off, and I was not believed at first because it wasn't something that was well known at the time. And it turned out to be very catastrophic for my right leg. And I was in the hospital for 6 weeks, had lots of surgeries. They nearly amputated. It was very scary. And then we went into the time after that where I was in a wheelchair and then finally got up onto crutches, and it happened in my left leg. So it was one of those things that was very traumatic. And then in the years following, there were a lot of interruptions to my life. It felt like there was just recurrent ruptures, one after the other, of all kinds of medical problems, just beyond my legs, even at that point. And I think the way I think of it is that it was like a medical PTSD or PTSD of my body. The way I think of it now is it's really of my nervous system. My whole nervous system was traumatized. So I had all kinds of things from chronic fatigue syndrome for a year. I had mono for a year. I had mast cell activation disorder. I had CRPS. I had, endometriosis, you name it, all kinds of things. So it's essentially a history that was very frequently interrupted, and my life felt like it collapsed a number of times during that period.
And how many surgeries did you have over that time? Because you had surgery right away initially when it happened when you were 16, right?
Yes, I had something like 5 surgeries pretty much right off the bat, and it's been, over a dozen all told since then.
And and so I mean your resilience in getting through that is amazing. And that went on for I think 25 or 30 years of relapsing, remitting, feel a little bit better, something pops up, more surgeries. And so can you walk us through how you found this concept of mind-body medicine and what happened from there? Because that was what, 5, 6, 7 years ago at this point?
Not even. It was 4.5, 5 years ago, and it was a Facebook ad on Curable, from Curable, and I looked into it and got interested, downloaded the app, did it all. It's like as extremely immersed in that as I could be. I That's what I did, I did the app, and then I eventually signed up for curable groups and was part of that. Shout out to my pit crew, is what we call ourselves. It's our 4th anniversary right now. And yeah, so I found the work at that point, and then I really immersed myself in the pain science. I took some coursework in it and eventually got trainings and certifications around in that area because it helped me so much.
And it helped you, I mean, it helped you significantly with the pain. You felt a lot better. I think you were able to do some things in your life that you hadn't done before. Is that accurate?
Yeah, it's interesting. I still, and this foreshadows what we'll be talking about, but I still had, constant pain of a certain level. But what I found with the mind body work was that I was able to get back to more activities and relieve a lot of the suffering around that. And so I was able to get back a lot of my life and just really feel much more empowered than I had been.
Yeah. And then, so you and I recorded an interview 2 years ago. And so that was at the end of 2021. And we kind of concluded that interview by saying, and then you found mind body medicine. And it turned out that maybe 90% of what you were experiencing was due to what was going on in your mind and your life, and not necessarily in your body, despite all the physical trauma, surgeries, and all the rest. And so, my sense is that over the last 2 years, we've realized that maybe that's not quite true. And so, why don't you tell us, kind of picking up from there, what your experience has been over the last couple of years now?
Yeah, thank you. And so when you and I met last, I remember telling you and your listeners, I went jogging, this is great. I'm back to all these things. And I still had a contracture, a significant knee contracture. And I still had, constant daily pain, but it was lower, all those things. So I was just thinking, I'm, home free here. This is great. And then womp womp, after you and I met, it was like that's when things started to actually fall apart again. And it was around the spring of 2022. I had what felt like a tweak behind my left leg. And then I had a series of tweaks. And then the nerve got more and more irritated and extremely painful. And I ended up just housebound. So I spent the spring and summer of 2022 housebound. And believe me, I spent a lot of time blaming myself because I mean, there was one low moment where I was like, like army crawling to my freezer to get more ice, thinking like, but I'm a pain coach, guys should be able to figure this out. And I think what ended up happening is I realized that the balance sort of tipped, and I realized I need to trust that voice that was saying something was amiss and I need to get this checked out. And so I think it really was that moment where I relied on the work I'd done in the mind body, sphere. And that is what gave me the confidence and the courage and the voice to be able to speak up for myself and actually go back to the medical system, which had so traumatized me. I was scared to go back, but I really credit mind body work with helping me be able to do that.
Hmm. And so, who did you seek out then? I mean, certainly you've known any number of physicians and surgeons over the course of your adult life. And so, where did you start? How did you start to enter back into the medical field at that point?
Well, once it got bad enough, and I was in 8 or 9 out of 10 pain all the time at that point, I thought to myself, I should probably contact my old surgeon. He was retired. He put me in touch with the person who'd taken over his practice. And I screwed up all my courage and I went to see him. That is sort of where that whole journey started. But even with that, I really had to speak up because I originally got an MRI that didn't show anything. And then I really had to advocate for myself to get the specialized MR neurography to show the nerve. And then even then, when I met with my surgeon, he said, there's not too much that came up on the report. Let me show you on the screen here. And he rolled in a little wheelie thing with the MRI up on, or MRN up on it. And we went through it together. And I'm like, what's that though? And he said, oh, that's right in the area you say you have the most pain. He's like, what is that? And he's like, well, that's a little ball of something. I don't know what it is. And I'm like, could that be something that is causing this pain? And he was like, it really could be. So we found it together. And I again credit my mind body work for getting me to a place where I could really have the courage of my convictions and self trust and agency to be able to speak up and get the care I needed. And even he,
Yeah. I mean, because it's hard, right? I mean, physicians are like, we're powerful, we're kind of arrogant, we sort of come off as like we know everything and you don't. And so to be able to sit in that room and say, like, hey, just go back for there. I want to see what that is. It takes a ton of courage to be able to do that.
yeah, there was a little bit of, getting over old programming and saying like, I really have to speak up for myself here because I feel something's wrong in there and it's only gotten worse. And I have applied all of the mind body tools that I have ever learned and it has not done anything. And so I wanted to really give myself that sort of vote of confidence where I say, even if I'm wrong about this, I'd rather be wrong backing myself, listening to myself, than listening to somebody else and ending up being wrong. So that did take some courage, and I'm really glad I did it. But one of the things, and this is something where you played a role, Dr. Stracks. You and I talked not long before the surgery, and I think it had already been scheduled, maybe, but I was had cold feet. Like, Dr. Stracks, is this crazy? Should I be doing this? I don't even know. Like, what if it doesn't? And I remember you said, like, look, you're disabled by this. You can't walk right now from all that you've told me and the test results and everything else. It sounds like the most rational thing to do as a next step. And you want to get back to walking. So, I think it's the right thing to do. And it meant so much to me to have your blessing because I was scared. I was really scared. Yeah.
Yeah, and I think that, those of us who have immersed ourselves in the mind body medicine world, there's, for good reasons, a ton of attention paid to the mind side because the rest of the world is paying so much attention to the body side and pretending oftentimes like our mind doesn't play any role at all. And so you and I and others spend a lot of time encouraging people to meditate and to journal write and to read and learn and educate and pay attention to emotions and feelings and negative thinking. And so it's always feels like somewhat of a slippery slope to drop down into that more physical side and say, hey, what if this is the issue? And you've had a lot of experience in it wasn't necessarily the issue. That was your how many surgeries? 17?
This last one is 17.
Yeah,
Mhm.
17 surgery. And so it's not like everything made it all better. And so even in that moment where I said, I think this is the right thing to do, I don't know that I thought it was 100% the right thing to do because, neither you nor I have a crystal ball. And so we took what we know, we took your experience, we kept in mind how much knowledge you have on the mind side of mind body medicine. And like you said, like you threw everything that you knew at it and it wasn't budging. And so when I talk with people about mind body medicine, what I frequently say, almost always, is that pain isn't necessarily about damage. And so even if there was scar tissue on the nerve, which I think in the end, that was the answer, correct? And so even then, the pain wasn't coming from the scar tissue. Scar tissue wasn't causing the pain. Scar tissue was alerting your brain that there was a potentially dangerous situation going on. And so the pain's not about the damage, pain's about the sense of danger. And sometimes the danger is a physical situation that we need to take care of. And so part of my job as a physician is to listen to people and look at people and examine people and say, I don't think there's a physical issue here that we need to take care of. I think the danger is coming from our thoughts or our feelings or stresses or past traumas or whatever else. But when there is a physical issue that's profound enough that we can't heal unless it gets taken care of, we need to look at that too. And that's where you stepped in and said, you believe, and you talked with me, and I believed that there was a physical aspect to this. And so you stepped into that space and you had the surgery.
Absolutely. And, in the surgeon's report, they're usually very sort of staid in their language around this stuff. And he said, he was, he said this nerve was completely encapsulated by a tremendous mass of scar tissue that was strangling it and adhering it to the adjacent lateral nerve knee tendon. When he came out of the surgery, he said, there is no way you would have been able to walk unless we released this. And I'd had a significant contracture, and because of the surgery, those things have been able to get a whole lot better. So like you said, it's sort of a more nuanced picture than sometimes we, might start out thinking it is.
For sure. And so when was the surgery?
September 2022.
Okay,
Yeah,
and we're in
11 months.
August of 2023 now, and so almost a year later. And so, what was your recovery like after the surgery?
Well, I'm allergic to all pain meds. And so I'm not going to lie, it was absolutely brutal because if you operate on a significant motor nerve, it's going to be difficult. But that's again where I use my mind body tools in a really significant way. I don't think I could have gotten through it without them, honestly, because again, I did not have any other sort of opiates or anything like that. And the mind body work really saved me because it was one of those things where I was learning moment by moment, like how to get through with breathing and meditation for a time there. And then once I got into recovery and rehab, I was able to devise my own sort of physical therapy program using graded exposure and graded imagery exposure and all those things. And eventually I got to the point where I was walking and I was hiking again, 2 hours at a time and deliriously happy. I love hiking. So I was so happy to be back. The contracture was almost, completely gone. I'd gone from something like a 30-degree angle to down to like a 7-degree angle or 7 degrees away from straight. And so I was just, thrilled.
Mhm. Yeah.
Yeah.
And so is that where you're at now? Is that sort of doing all those things, doing what you want to do, able to hike, walk, exercise, all the rest?
Well, so what happened then was a big 3 month flare. I am better and back to that point again now, but there was a 3 month period there where I had a really significant,
And
yeah.
that 3 month flare, I think, is interesting, and I want to talk about it at some length. And I'm going to put it aside for just a minute because I want to talk more about kind of what you know and what I know about trying to blend this world where there are both medical issues and our mind is important. And so I want to explore that a little bit more, and then I want to talk about the flare.
Yeah.
And
Yeah.
most people, before they learn about mind body medicine, think that pain is a physical phenomenon. And what I say to people is that, you grow up, you sprain your ankle, you skin your knee, you can see the injury and it hurts. And so there's no reason to think that pain is about anything other than the physical injury. But anybody who's watching knows that that's not true because anybody who's watching has tried a ton of different physical interventions and hasn't necessarily gotten better. And so the science over the past 30, 40 years has demonstrated that our mind plays this huge role and the pain comes from the brain. And like I said, in response to the sense of danger, and danger can be physical, danger can be emotional, danger can be psychological, it can be a combination. And so once people enter into this world, it's very tempting to leave the physical aspect behind. And some people can do that because some people's bodies are completely healthy and the physical condition has nothing to do with their symptoms or their pain. But others have autoimmune disease or a history of surgeries or spinal abnormalities or tissue injuries that haven't healed. And so for a lot of people, there are physical aspects as well. And so, can you talk a little bit about, especially in these last couple of years, what you've learned about combining these two spaces and being able to pay attention both to the physical and the psychological as you go along?
Yes, I think that is so important because I think I fell into that whole tendency to see things in this dichotomy of it's either this or it's this. And I think that, can keep people stuck for a long time. And so what I've learned over the last couple of years is that there is absolutely no reason that we can't do both. And I think, for a lot of people, we do have these sort of structural physical issues, and mind body work is also a part of that. Anytime you have any kind of physical structural issues, conditions, whatever, there's always going to be an overlay of mind body, neuroplastic, whatever you want to call it. And so from my perspective, what I think the shift happened after I last talked to you. I think I'd gone from sort of giving all my power away to sort of the medical world, like, before I found my body stuff, gave all my power away there, and then, listened to whatever they said. And then I think after a while, I actually gave a lot of my power away to the mind body is the only paradigm idea. And I think what I had to learn is that I had to really take my power back and see myself as an agent in my own life. And these things are tools, right? Like, so, medication can be a tool that is really useful for people. Medical intervention is sometimes necessary, and you can see that as a tool. Mind body work has so many tools that help us through all of the pieces of the puzzle. And so the more I shifted to seeing myself as being in control and having agency and being able to consciously, carefully, calmly choose which tools I use, that way I was able to sort of begin to blend, both of those things that I previously had seen in this sort of binary.
And if there are people who are just starting to learn about this, or people who don't necessarily know what kind of tools they are, what are some of the tools on the mind side? And then ultimately, what are some tools on the body side that you've used? But starting on the mind side, what are some of your favorite mind body tools that have been helpful for you over the past number of years?
Yeah, I think for me, it's been a lot about fear reduction and facing fears, challenging fears. And so when there were things that I was, sensations I was afraid of, learning to sort of bring about a kind of authentic indifference toward that, a compassionate listening, but at the same time beginning to take some of the fear out of it. Graded exposure has been my friend throughout this entire process. So that's something that you can do when there's something you're really afraid of, an activity or otherwise. Graded exposure is a way that we can gradually, you know, where the brain still feels safe. It's like, what are you doing? This is new, but you can do it in such a graded, gradual way that you can help yourself get back toward the activities you love using that.
Do you have a specific example of a time you've used it to get back to doing something that you want to do?
Yeah, absolutely. I think it started with after this last surgery, coming up with my own PT routine, because originally what happened was my PT had told me, she's wonderful, she's absolutely wonderful, but she had been told by the surgeon, like 150 heel slides, that's what she needs to do every day, like right after the surgery, to make sure that, the nerve stays loose and free. And that turned out to be just like my brain, the amygdala is like, whoa, this seems really scary, and it just was like, was not having it. And so one thing that I did in concert with my physical therapist and my mom, who's actually really good at devising these kinds of programs, is figure out a graded exposure way to get myself back to movement. And so just to make it really concrete, I couldn't even imagine straightening my leg after the surgery. Like, I couldn't picture it without feeling like I was going to throw up. So I would look at Google images of, little videos of people like straightening and bending their knee, and they have a smile on their face. They're just fine. They're fine. They're not in danger. So that graded imagery exposure got me gradually used to the idea of, I can do this and I can begin to do this myself. And so bit by bit, just kept approaching, doing a little bit more toward that, like a little bit today, and I got through that, a little bit the next day, a little bit more after that, and it just builds upon itself, and you do build some confidence as you go.
Hmm. Do you need to keep a smile on your face as you do, as you talked about sort of seeing that in the people who you were watching, as you were learning to straighten your leg again? Did you have to do it with a smile or confidence or reminder that you were okay?
It's funny you say that because it wasn't a smile per se, but in my mind, I was picturing this kind of power pose, like I got this, like I know what's happening here, I can do this. And so, yeah, I think there is something to that to be able to remind that scared part of your brain that this is actually something we're going to do in such baby steps that it's safe, it's okay, and it's something that we can do gradually without going into any kind of danger.
And one of the things I love about what you're saying is the agency of it. And so I think oftentimes when people have been in the medical system, like you said, we give our power over to the medical system. And so we wait for somebody to tell us what to do. And so does the physical therapist give you a graded exposure strategy? Maybe, but you know yourself better than any physical therapist does, better than any physician does, better than any surgeon does. And so I love the fact that you took the people who are closest to you, physical therapist you really trust, your mom, and you said, like, this is the program that we're going to put together, and this is the program that you're going to follow. And I think it's so much easier to be able to have confidence in that when you've had a hand in creating it.
Yeah, and if I might add, I think it was against the backdrop of my having first been a very good student, listened to the surgeon and the PT who said do 150 heel slides in a day. And I like, religiously did that. And that's when I realized that, the outcome of that was really, really not good. And so it was this light bulb moment of like, oh yeah, I lost my agency. I was just listening to them. I wasn't listening to myself or my body. And I need to like kind of reset, reground in myself, remember my agency, listening to my body, and like doing this gradually with this team of people. And that's really how I got that back.
And then, we talked about reducing the fear and then the graded exposure, which blends the psychological side and now starting into the physical side. Are there more physically based tools that have been helpful for you in the past year since you've had the surgery?
Yes, I mean, I have certainly done a lot of, well, I don't know which parts you would call physical or not, but I think have gone back to sort of doing, and we can talk about this hopefully later when we talk about, how I got out of the flare, but some physical touch stuff that I was doing and things along those lines. But I also think that that physical therapy piece was certainly very physical. The exercise that I engaged in, very physical. And I'm not ashamed to admit I have, used medication to help me with this process because it does take nerves a couple years to heal from this kind of thing. And I'm 11 months in, and if there's nerve pain, and that's sort of one of the things that I want people to hear from my story because you can beat yourself up about these kinds of things. And so, yeah, so I was able to just sort of say to myself, you know what, I'm using all of these things as tools. And if the medication is something that helps put a platform underneath me to be able to do the mind body work and really gain and make a lot of progress, and yeah, I'm going to do that.
Mhm. And so people who are listening, right? Like I said, people enter into this from the physical side almost always. There's very, very few people I know who intuitively understand pain and symptoms in a psychological way. And so people at the beginning almost exclusively are using physical tools. Learning about this is so helpful because you realize that there are lots of things that we can do that don't have anything to do with the medical system that are useful. Some of the things that we've talked about, also journal writing and psychotherapy and deep breathing and visualization, and all of those play a big role in people feeling better. And so, like you, oftentimes people move to this side. We're focusing mostly on the physical and emotional. And so, what you and I are saying is sometimes you have to swing back, let the pendulum swing back towards the middle, which sometimes is annoying for people. Like, we're human beings, we like to be this or that. We don't want both. And
Yeah.
so as people are listening and saying, like, gosh, how do I find a surgeon who's gonna sit with me and look at the MRI? Like, how can people have confidence that they're in the right space no matter what space they're in.
Yeah, I'll share a tool that I have used in this regard. I call it the power of the pause. I think about the quote by, Viktor Frankl, talking about the space between stimulus and response. And the more we're able to sort of create a pause or a space between stimulus and response, the more we can kind of actively, intentionally, consciously choose how we respond. And so I think, if people are in that space where they're trying to figure out like where do I go from here? I think it's about getting quiet and really developing the power of that pause so that you can have that capacity to choose something that feels right to you. So you're not letting your symptoms like drive the bus. You're listening to them, but you're not letting them drive the bus. And you're not just blindly following whatever your, surgeon, doctor, therapist, whoever is saying to you. And so I think for me, that has been one of the most powerful things, is to really get quiet and take some stock. Like, hear all the voice, like I picture a big committee table, like hear all the voices in the room in my head. And it's like, I'm listening to you all, and the pain has the voice and the symptoms and all of these other people. But can I really get quiet and feel what feels right to me? And that is what has guided me through this. And I think that's an important piece, is the self-trust.
And I think, Dan Harris, who wrote the meditation book, 10% Happier, he talks a lot about that pause too, that meditation doesn't turn you into a different person, but it just a little bit increases that space for you to make decisions between like you said, the stimulus and the response. And so that's where some of those tools on the mind side can come in so handy as we're trying to sort through what's the next step. And then I also talk with people a lot about the fact that sometimes all we can figure out is the next step. We all live in a world where it feels like we should know how to get there. And I was talking to somebody about this yesterday, that all the different choices that he was thinking about in terms of career and relationship and what he was going to do with his life, it feels like we have enough technology that we should be able to know, like to live in a big city or live in the suburbs, work in tech or work in medical device. And in truth, like we still don't have any way to see the future. And so all we can do is take a step, see where we're at, decide what the next step is from there. And we also live in a world, right, where if we take a wrong step, like 6 billion people are going to see it on Facebook, or be like, oh my goodness, how can I do that? And so we have to, like you said, have enough confidence in ourselves that we can figure out how to walk the right path. And even if it's one step at a time, that keeps us moving forward.
Yeah. Yeah, absolutely. Because we can't know beyond that. I often think of like the blind man's bluff game, as we played as little kids, like what feels warmer, what feels cooler, which direction I go might even be as simple as what I'm drawn toward and what feels warmer,
Yeah.
just one step at a
We
time.
we have a group here called Cormindy Academy, and we just finished talking about fear for a couple of weeks. And this idea that we get scared of the situation, but even more so, we get scared that we're not going to be able to handle the situation that comes at us. And so moving into these spaces with this idea that no matter which way we go, we're going to be able to handle it. And if we find we're walking down the wrong street, we're just going to turn around and try a different street. But it's not the case that we're going to make this decision and it's going to be life changing, that we're never going to find our way out of it. And so having that confidence that even when pain and symptoms are involved, that we can go in one direction and we can handle what comes at us in that
Mhm.
direction.
Absolutely. And it reminds me a little bit of the decision right before the surgery, because I think for me, that was, I had to do a little bit of outcome independence with that and say, I don't know what the outcome will be, but I know that I am standing by myself in what I feel is the right next step. And I'd rather feel like I've got my own back with that and I'm listening to myself and be wrong potentially, than to, follow somebody else and not be
Right.
honoring
Yeah.
that knowledge.
Or even
And
taking right and wrong out of the picture and saying, or have this particular outcome that I don't like as much and have to keep working
right,
to figure out where the
exactly.
right outcome. is going to be. And so let's shift gears a little bit. So let's go back to this most recent flare up, because flare ups are annoying as somebody who had a big one maybe 5, 6 years ago, and who's had a couple of episodes over the course of my life with significant disease and symptoms. They're never fun. And my own personal experience is that they're hugely educational. And so what happened? So you'd had the surgery, you did the rehab, you were doing well, you're going out, you're going for long hikes, you're living your life.
Mhm.
What happened then?
Yeah, so went from deliriously happy to one day I'm walking along and I felt that tweak I had felt last year. And then it happened a few more times. And each time, I think it was something like scar tissue breaking or rubbing against the nerve is what they think, but it doesn't matter. There was a tweak and it just sent me spinning because I was like, oh God, that's the exact same time this happened last year. The tweak is what started the whole downward slide to the surgery number 17. Oh no. Right. And so I think it just got worse. The pain escalated more and more because while there was some real or physical irritation to the nerve, which is still healing, and it's only 11 months or whatever months in from that last surgery. So there's some physical stuff there, but I think the element of feeling like, oh no, I know this, the sky is going to fall again. This is it. I know what's happening. This is exactly the time it happened last year. This is exactly how it went down. And before I knew it, I was housebound with pain again and thinking, oh God, this is the same thing all over again. So I spent a bit of time in that unfortunate headspace. Yeah.
And you're not there anymore. So you found your way out. And so how do you start to work your way out of this?
I think I really realized the role of trauma in all of this. It really became clear that there was, some trauma from the previous, instance of what had happened last year, happened at the anniversary and all of that. And I think, yeah, oh, sorry, good.
No,
Did
no,
you?
no. I was going to say, I mean, trauma is it's such a big subject, and it's so relevant to people who are working their way through symptoms. And when people experience traumatic situations, whether it's as an adult or as in a child, it's important in those moments for your brain to be able to recognize danger. And what we're talking about is that symptoms are a response to our brain's sense of danger. And so when you've experienced trauma, of course, symptoms are going to get heightened. And so the task is to figure out how to heal from that and calm down the brain sense of worry, which was totally appropriate in the traumatic moments. We want the brain to worry when there's life-threatening danger going on. What we want to teach our brains to do is not to worry in that same way when we're not in that same kind of dangerous situation. And so what kinds of things have you been thinking about and learning in this regard? And what's important as we start to think about the role of trauma and what it plays with all of our symptoms?
Yeah, thank you. It's something I think that I see in a lot of my own clients who come to me stuck is that, often there's some trauma background. I think for me, the trauma, what it feels like is it's kind of like a scary magic funhouse trap door that opens. It's like you're going along and suddenly the tweaks happen for me and it like sets off some memory in my brain of like, oh, I know this, opens a trap door and I go immediately back in time. And it's sort of like I became this like time capsule of a previous self where, yes, my life had collapsed before and it had multiple times. So I think I probably went back all the way to 1991 where I really was helpless. I really was powerless at that time. But I'm not there now. I'm in, 2023,
And
right?
but that's what traumatic memories do, right? I mean, the brain codes trauma differently than it records like remembering being at a baseball game when you were 14, that it gets coded differently so that because of the danger, so that we can bring it back when we encounter a similar situation. So that's what PTSD is. If you think about military veterans who have it and they can hear a helicopter and all of a sudden they're back on the battlefield, it's a strategy that our brain will use to try to keep us safe. And so that's why I think it's so easy to find yourself back in 1991, even if it started with just a tweak when you were walking down the street.
Exactly. It can be something so simple. And so I think it is where you become like that old, I was that old self suddenly. I was just in this sort of zone where I wasn't even aware that I was sort of operating as if I was helpless and as powerless as I was then. One of the things that I think trauma also does, I often think of like the car wash analogy, like I use the car wash as an analogy. Like, you kind of drive up to the car wash and they say, like, just make sure your wheels are on this little track, and then there's nothing else you have to do. The car just goes, it's on that track, like, for the whole ride. And I think one's brain on trauma can be like that, like, oh, here's this track, I know what to do, I don't even need any more instruction, I'm going to take it all the way to the end. And for me, that was very much happening, where it was like, oh, I know what this is. This happened before. My life's going to collapse. The sky is falling, et cetera, et cetera. And it was sort of in that track. So that's where I think trauma can really complicate the picture, because of course, once that happens, as we know, fear amplifies any sensation. And so while I was having some real sensations in there and the nerve is still healing and all of that kind of stuff, I had, I think, a tremendous amount of amplification because of that, like, sudden just terror.
Mm-hmm. And so, how did you find your way out of the car wash? How did you get off that particular track and put yourself on a track that felt better?
Yeah, I think part of it was really remembering all that I've learned and knowing about predictive coding, and this is what the brain does. And then going back to my original tools and saying, like, okay, I need self-trust, I need agency. And I literally sat down and made a list of all the ways that today was different from a year ago.
You literally, right? You literally, I mean, and I think this is important for people to hear. Like, it's not that you thought about it. I think you took out a piece of paper or a computer document and you said, like, here's 1991, here's 2022, 2023, wherever, 2023, I guess. And you literally wrote those down, right?
I did. And I did it even like for the last year. So, because it felt like a repeat of last year. So I was kind of doing a combined thing of how are things different now? And that started to ground me in and remind me that, oh, right, there's a lot of predictive coding going on right now that's like putting me into that car wash track that's not necessarily accurate as a representation of what's happening. Yeah.
And you started feeling better, right? You're feeling better now.
I did, and I think the other big takeaway for me from this flare, and I think of, like, I think about words a lot, and I'm like, flare, what is that? Like, you got out in a dinghy and you put up a flare, like call for help, signal, whatever. And I think that's what this was for me. I think it was a big lesson and, reminder about a lot of things that I needed to remember or know. And one of those things was the role of other people. And if, I could tell sort of a little story, if we have time, just on this desensitization work that I did. My partner helped me with desensitizing my legs. So I'd gotten to the point with this flare where my nerve area had gotten so sensitive that I couldn't stand anyone touching it, let alone being, or even being a foot away from it. Anything was water, fabric, clothes on that spot was not tolerable. And so one thing that he did with me was begin to just very, in this great, again, graded exposure kind of way, very gradually working toward that area that was most scary to be touched. And when we started, like I said, I couldn't handle any of that. He couldn't even massage my foot because it felt like it pulled the skin enough that pulled the whole thing. And I was like, I can't handle that. That was only a month ago. And we've gotten to the point gradually over time where, he was sort of able to get closer and closer to that spot. And now it, like, can sort of that the entire area is so much better now. And it's gotten to the point where I went from feeling like my legs only ever feel pain. That's all they've ever felt, to feeling like, oh my gosh, my leg can feel good. What? And it was, really my partner helping me realize that, and sort of bringing me out of my own shell and thinking that this doesn't have to be like the script would tell you is going to be. It's not all pain. We're not only here for pain. And we really need other people to be able to help us remember that.
Who else? Who else is on your team? And so people you've mentioned so far, your partner, your surgeon, me, your mother. Who else plays a role?
My best friend. So we voice memo each other every day, believe it or not, quite extensive voice memos. And one thing that I want to say about that, and this may get kind of cheesy, but I don't know if you know the children's book, The Velveteen Rabbit.
Yeah, I read a excerpt from the Velveteen Rabbit at my sister's wedding in 2006, I believe.
Oh, nice. And right, so it's sort of the idea that this little stuffed animal like wasn't made real until he was really loved. And so my best friend and I talk about how, apart from apart from family, like unconditional love is hard to come by, but she and I have given that to each other, unconditional love and support. And through this whole thing, she has believed me, she has stood by me, she has shown me that. And so it feels a little bit like that we joke about the Velveteen Rabbit, because it's sort of like, loving each other real or into existence. And I think I cannot overstate how important that is, because I think one of the pieces of that's so hard about chronic symptoms is that it makes people feel really, really alone. And that is hard, almost as hard sometimes as the symptoms themselves to manage. And we really need other people, hurt people especially need other people.
Mhm.
Um,
And how do you work with your clients to start to find those people? And so sometimes when I'll talk with patients about this, and like you said, it's really lonely. And so they don't necessarily have people around them who they feel like are supportive or can take on those roles. And so how do you coach people to figure out where those other people are in their lives?
Yeah, absolutely. And I think sometimes starting out, sometimes if people don't have that kind of support right around them, groups can be really helpful. I've seen people do so well with groups because suddenly there's a group of people who get it and understand. You don't have to explain. So that can be a great source of having this kind of community around you. I also think even just starting with working with a therapist, if that's something you need to do, especially for those who have trauma, they need to work with a therapist around that. And even just that one-on-one relationship can be incredibly powerful in reminding people, like, no, you matter. Like, life is about more than pain. You don't have to just feel these symptoms and suffer. Life can be about much more than that, and joy and connection and belonging and purpose and meaning. And so seeking out those people and those relationships, even if you don't have family and friends right around you that feel like they could be a fit, there are other ways of going about this.
Mm. There's such a big community now of people who understand the mind and body connection. And so when I first learned about this, it was the 20th century, it was late 1990s. And there, were some people who had read Dr. Sarno's book, but that was it. Like I didn't know how to connect with other people. And then these days, all the various groups that are out there and the apps and the Facebook groups, and there's just, there's a community of, I think, well over millions of us who are interested, active, supporting each other, working on our own situation. And it's delightful. And it's amazing to see how that's grown over the past, say, 10 years.
Yeah. Yeah, it's really exciting. And so I think that you're right. Those online groups can in themselves be a source of support and validation and not feeling alone, reminding yourself like, hey, this is something other people experience as well. And you don't have to be alone with it.
Yeah. Anything else that you work with your clients on in terms of trauma? Any other resources that you like, or any other aspects of it that you work with people on?
Yes, I think one thing, and this sounds fairly simple, but is, sort of thinking about that car wash analogy, thinking about whatever it is that whatever the old narrative is that's trauma based, like, oh no, it's happening again, like the sky's going to fall, like I'm going to lose everything, everyone's going to hate me, or whatever the narrative, and really labeling whenever that comes up in one's mind, like, oh, there it is. There's the old tape or the old narrative, and really working to put a little bit of distance between you and that. And sometimes I think of the work of Byron Katie. So looking at that old narrative and just saying, is that true? Do I know 100% that that's true? Usually you can't say yes. And so it opens the door for a new narrative. I think that's really important.
Yeah, and sometimes I'll have people just start telling that narrative, the new narrative, whether it's true or not. And we live into our narratives. And so if our self-talk is constantly about how, I tried, it didn't work, I keep backsliding, that I invite people sometimes to just start talking about, like, I'm doing really well. People ask you how you're doing, like, I'm doing really well. Thanks for asking. And keep talking in that way and see if you start to follow that new narrative
Yeah.
around.
Yeah. Exactly. I think you live into the new narrative. And I think we talk a lot about living a life you're proud of. And what are the things, regardless of where you are in your journey, regardless of what your body's doing today, what are the ways that you can live a life you're proud of today? And what does that look like? And can you keep living into that? I think often of my dad when I was growing up, he had gone to medical school and he was a psychiatrist, and so he had loads of school. He had like decade of school, and I was like, Dad, how did you get through like however many years of school and fellowship and blah blah blah? And he's like, well, I was living the whole time. And I've always thought of that because we're living the whole time, like even whatever's going on with our bodies and our symptoms, wherever we are in this journey, we are living the whole time. And that's where we have agency to say, how do I want that life to look? And what things can I contribute to that, what causes larger than myself can I belong to that will help me have that sense of community to get through this, because healing really is it's a social process in the end.
Mhm. Trauma oftentimes happens in community. And so I think a lot of people who work in the trauma world feel like community has to be part of what lifts us back up. So last thought, and then I think we'll wrap up for time reasons. But the flip side of being involved in some of these communities is this idea that everything has to move forward. And so any thoughts about how to keep looking forward even when your physical condition is declining? Because a lot of times people, I think, will feel like, they've failed somehow, or everybody else keeps moving forward and they're now stuck behind. And so any thoughts about how to stay away from that headspace if you're not feeling great?
Yes. I first want to say I totally understand. It's so easy to feel like a failure, but please, 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 people out there, like you are not a failure. No shame, no blame, no judgment. One thing that I think has been really helpful for me is to whether it's true or not. I think of the Pema Chodron. This has this wonderful quote about, just so I get it right, nothing ever goes away until it has taught us what we need to know. And so sometimes I think if a flare comes up for people, or a setback, whatever you want to call it, things come up, new symptoms, otherwise, I think believing something along those lines, like, what can I learn from this? What do I still have to, glean from all of this? What are some ways this is helping to guide me to a better place in my life? How can I move toward better self alignment, whatever that is? Because whether or not that's true, whether that, way of thinking about things, whether that's true, it helps you look at it in a way that puts you back in the driver's seat, makes you your own agent of your life and the meaning maker of your life, and really being able to look at it and say, this is how I choose to move forward in my life and living a life I'm proud of, regardless of what the pain number is today, or regardless of where I am in my, flare up or whatever. that's been really helpful to
And
me.
I think when we got on, I described your healing journey, and it just strikes me how much of a journey it is. And throughout human history, when we write about people's journeys, it's never straight to the moon, right? There's always ups and downs and challenges, and part of being a human being. And I think this is no different. That the parts where we're moving forward and feeling good, those are super fun, and the parts where that's not happening, it's not fun in the moment, but it's part of what makes us human beings. And it's part of what connects us with the world. And so many of the skills that you've described and I've developed and teach and see is being able to weather those downtimes and know that like this isn't bringing you right back to the beginning. You've learned so much and you can't unlearn that once it's in you. And sometimes we forget, or sometimes it seems like it's no longer there. But these down days are just so that we can gain momentum to go to even better places as we go
Yeah.
along.
Yeah, and if I could share one last image, my mom often talks about the spiral staircase, and I use this with regard to what you're talking about. We can feel like we're going around and around, and like we just look down, and it's like, oh, it's the same old stuff. I'm looking at the same old stuff all over again. Are you serious? I'm backwards. I've gone backwards, square one. But remembering that we are always going upward, and there's more and more perspective and depth there. And so I don't think you can really go back to square one if you really, really wanted to.
Mm, yeah, absolutely. So thank you. We are going to end there for now. Thank you so much for being here and sharing your insight and your experiences. I know how much people appreciated when we did this the first time, and I know how much people will appreciate this time as well. So thank you for sharing your knowledge and sharing it today.
Thank you so much. It's such an honor to be here and to be speaking with your listeners as well. So thank you, Dr. Stracks.
Yeah. For those of you who are out there listening, if you want to hear our first interview, you can find it at our Cormendi Health YouTube page. And if you are interested in working with me or our team here at Cormendi, visit our website at cormendihealth.com, and our staff will get back to you with all the details that you need to know. And finally, thank you to all of you who were here and were listening. Every time I record, I'm reminded of just how blessed and touched I am to be part of this community of people who are working so hard on healing and doing it in these brave and creative and cutting edge ways. And so we will end there. Hope everybody has a good rest of your day, and take care.